Today we have Rebecca. She's never seen a chiropractor before, and she's agreed to kind of show you what we do in our office for the very first time. Are you scared?
Kind of.
A little nervous?
I'm nervous.
What are you most nervous about?
I'm not nervous. Never tried anything like this.
What do you know about chiropractic care?
Nothing really.
Nothing really.
Just like when you see on TV, you know?
And what is that?
People messing up people's necks.
Messing up people's necks. Well, what we're trying to do here is we're going to first do a screening, what we talked about earlier. We're going to screen to see if there's any specific area of your spine that have more stress than others. Now, do you feel any stress in your back right now?
Yeah, my shoulders.
Your shoulders a lot more?
Yeah.
So Dr. Han is going to do a screen using an SEMG, which is similar to what we talked, like an EMG.
Yeah.
Tests like the health of your heart. Well, an SEMG, what we call a spinal EMG, is going to use electrical impulses to check up and down your spine to tell us how your spine is responding, and it'll give us a stress score so we know what areas to focus on when we do our evaluation on you. Okay?
Cool.
So we'll begin, and you have your good. Your shoes are off. Great. Now we'll begin.
Full scan or just
We'll do our screening today. Yeah. You said that you're pregnant, right?
Yes, 22
so,
weeks.
22 weeks.
Yeah.
Okay, great.
Yeah.
Congratulations.
Nice and relaxed. Perfect.
Okay.
Okay.
So you're just gonna feel a little bit of pressure with the electrodes on your spine.
Ooh,
Just try to stay relaxed. Yeah, just try to
hands
stay
on.
relaxed. So we're going to go segment by segment, up and down your spine, to kind of sample every area of your back to see, to test where are the hot spots or where you're gonna have more stress. Then the next one.
Makes sense.
So Dr. Han just completed doing your left side. Now she's going to do your right side, doing the same thing. All green would be a stress score of 0, right? And then, so you have a 387 PP stress score.
Wow.
And you can see just by looking at the diagram what areas have more tension. Now you said your left side felt more. Now this is your left side. Actually it has
Less.
It's reading less, but that could be because there's so much tension there that the muscles aren't firing as well, right? So it's not reading as much of the electrical impulses in that area, and that's what it's showing there. This side over here, well, your right side is actually having a really high reading, and then opposite side in your lower back. But the most right here, do you see that number?
Yeah.
You have a really strong favor to the right side of your shoulder, and your left shoulder isn't firing as well. So those are the areas that we really need to focus on, and that's what you said, right? Your left shoulder.
Yeah.
So this kind of gives us a kind of a blueprint on how we can focus on your treatment. Now, the other thing that we would do in our office is also a structural kind of assessment by doing an X-ray. Due to your pregnancy, we won't do an X-ray.
Yeah.
But we'll rely on their SEMG to tell us where our structural problems may be. Dr. Khan will also do a quick evaluation up and down your spine, and then we can administer treatment for each thing as well.
Oh,
Right?
that's really cool.
It's cool, not so freaky, right? So when we are assessing your spine, I'm going to check your nerves to make sure that there's no kind of nervous issue, nervous system issue. After that, I'll do an orthopedic evaluation. So what that is that I'm going to check and do some tests on your joints and muscles to see what areas are acting up, which ones are weak, which ones are strong, which ones cause pain.
Okay.
The same test that you would get at any doctor's office.
Okay.
After that, we'll do a chiropractic evaluation. Now that's something you've never had before. And that's when we're going to check up and down your spine to see if there's any restrictions, or what we call subluxation. So restrictions are when your spine isn't moving properly, right?
Yeah.
So sometimes you feel like an area is very stiff,
Yeah.
or you've gotten massage therapy because you have tension in your shoulders. But even after the massage, it just kind of gets tight right away.
That's
Often, yeah. So oftentimes that's because there's a structural problem, not just a muscular problem.
Oh, okay.
So a structural problem means that there's joints that aren't moving properly, or there's a dysfunction in the joints. And then when the muscles try to move the joint, it won't move because it's stuck, right?
Yeah.
Imagine like you're pulling in the drawer, and so you're at the office and you open a drawer, but the drawer isn't on the track right? So you have to use a lot of force to get that drawer to open. And then if you had to do that over and over and over, your arms are going to get tired, right? So your muscles are going to get tired because the joints, right, aren't moving properly.
That's cool to know.
Yeah. So in your spine, if you have those issues, there's a dysfunction in the way your joints are moving, the structure and how the structures are moving, and your muscles are always going to have to work too hard. And then you're going to see what you saw in your SEMG where there's a lot of tension in there. And you're already doing a lot of work.
Yeah.
So may as well make it more efficient.
Yeah.
So that you can do it easier.
Oh, all right.
I mean, as easy as you can get.
Yeah.
So that's what I'm going to do today, okay? All right, so I'm going to check over with your reflexes first. And I'm going to start on your lower body and kind of work my way up, okay? So we're just checking your reflexes of the screen. Good, okay. All right, I'm going to check behind your ankles here too. Good, okay. And we'll check this one. Good, all right. And I'm going to check your arms now, so just relax your arm here. Good. Does that feel okay?
Yes.
Yes, he has overseas.
Good, all right.
And it's retired.
Good, okay. We'll check over here, nice and relaxed.
I'm sorry, that's my one.
Okay.
Growling, sorry.
Growling? Baby wants to eat.
I just ate a lot, actually.
Baby wants more.
Oh,
Okay.
yes.
Now we're gonna check your strength in the muscles too, okay?
Okay.
I want you to go ahead and push your leg into my hand that way. Good. And then pull backwards here.
Okay, perfect.
Good. Okay. Push on this one. Good. And then pull back. Does that feel okay?
Yep.
Good. Let's check your upper body. So I want you to hold your arms like that. Keep your elbows up high and your fists together. Keep them up strong, okay? Don't let me move you. Good. Okay, you can relax. How about when you're going down here? Okay? Don't let me turn your hands down, okay? Good. And then open your hands big. Keep your fingers out straight. Don't let me move your fingers. Open up like big. There you go. Good. Okay, you can relax your arms. All right. Now I'm gonna check your range of motion of your back. Okay. So I'm gonna have you turn your head left as far as you can, and then turn right as far as you can. How's that feel?
Good.
Good. How about looking down as far as you can? Okay. That's good. There's some restriction that way. Come on, look back. Kind of tilt your head all the way back. How's that feel?
Huh? Good.
Good. All right. Let's tilt your ear down to the side, and then this side. Any problems there?
No.
It doesn't want to go that far
Yeah.
on the right side, right? So you said the left side has a lot more tension. You can feel that when you tilt your head that way,
Yeah.
it doesn't want to go that way as much, right?
Yeah.
And that's because some of this is restricting that. Now some of that can be your muscles being tight. Another part could be the structure, right? The joint's not allowing that because they're restricted. So we're going to keep checking, okay? Does your lower back bug you? Or do you feel that?
Yeah.
Is it tender?
Yeah, kind of.
Yeah, a little bit. How about this one?
Yeah, I guess like more tender as I go up.
As you go up?
Yeah.
Okay. So I want to check my way up and down. So looking for those restrictions that we talked about.
Okay.
All right, and there a little bit on your neck too. Okay, so just relax your head. Kind of right in the mid part of your neck. This is around C6. And we count the bones in your neck from top to the bottom. So you have 7 bones in your neck, right?
Yeah.
So you have one, there's just like a picture over there. So you have 1 up here and then 7 down here. And right in the middle around C6 right there, you can feel that it doesn't, is that tender?
Yeah, a little bit, yeah.
Okay. Do you ever get headaches?
Yeah.
Yeah, how often?
Not very often, but I get like tension headaches.
Tension headaches, and where did the tension come from?
I don't know.
How's that in here?
Yeah.
Is that tense in
Yeah.
there? Does it kind of radiate to your head at all?
Yeah.
Yeah, so a lot of times the tension can come from the back of your neck right here, behind your skull. You have these muscles here called suboccipital muscles, and when they're really tight, they can irritate nerves that cause headaches up kind of behind your eyebrows.
Yeah, that's where I feel it.
That's what you feel? Yeah,
Yeah.
and I can feel that that's really tight in here, right?
Yeah.
And behind that, you have your cervical vertebrae, right? If those aren't moving well, then your suboccipital muscles are overworking, and then that can trigger the headaches too. So if we can get these moving better, maybe your headaches will go away.
That'd be nice.
Put your feet together. Feet together. Oh, yeah, knees apart, and then knees together.
Yeah, knees together?
Yeah, and then knees apart again. And then knees together. One more time. And yeah, so this one doesn't move as much as this one. Do you feel this one kind of
Tense,
tender
yeah.
right there?
Yeah.
So I found those restrictions up and down, especially the hip here, okay, the neck, that part of your cervical vertebrae on top around where the suboccipital muscles are, and then down in here. So we can start getting those moving. Sound okay?
Okay.
All right. How do you feel laying face down?
It's fine.
Fine? Okay,
Yeah.
we're going to take your glasses off. You can set them on the table there, and then I'm going to lay your face down.
This way?
Yeah.
Okay.
Okay, so I'm going to scoot you towards me. Alright. So it's right in this spot here. Is that okay?
Okay.
So just right, relax the shoulder. Alright, so then you're going to take a breath. Good. And then you're going to breathe all the way out. Good. Good. that. Is it okay?
Yeah.
How did that feel?
It feels the same. It's kind of cool.
It's kind of cool. Did it hurt at all?
No, it doesn't hurt.
No, okay, let's lay on your back. All right, do you feel any difference?
Yeah.
What does it feel like?
It feels like relaxed.
It's more relaxed, right?
Yeah.
So that's a really good word to use because it does. It kind of allows those muscles and those joints just to...
It doesn't feel as tense anymore.
Right, so you've been tense for way too long.
Way too long.
Yeah, so you should have been here a
Kids
long
back
time.
to back.
Exactly, okay. Let's cross your arms here. Now I'm gonna check that mid-back spot right there, okay? So let's do a sit-up. I'm gonna have you lift your head up. Yep, just like that. And lay back down. There you go.
Oh, that was quick and easy.
Yeah, no problem.
No.
It hasn't hurt at all so far.
It has not.
Okay,
Not
good. Nothing to be scared of, right?
Yeah, no.
Okay, you can relax your arm.
It's funny to think I was scared of the chiropractor.
Now it's just funny.
Yeah.
Did you think I look scary?
No.
Okay. So right here, so this is what we talked about, where your headaches are coming from.
Yeah.
Right back in here. Now if I can get this moving better, you're gonna have less headaches. Right there, okay? Do you feel anything radiating to the back of your eyebrows there?
Not right now.
Not right now, okay. So tell me if you do, okay?
Oh, right there.
Right there, so
Yeah.
that you can feel that kind of that headache forming?
Yeah.
So I'm gonna get that moving there, okay?
Okay.
All right, just relax. Okay, relax that one right there. Good, and we'll breathe out. Good. Okay?
Yep.
Were you scared?
Yeah, it scared me,
Yeah.
but I was fine.
But it's fine? Didn't hurt?
No.
How does it feel now?
I don't even feel that pain anymore.
It doesn't hurt anymore, right?
No.
And it's moving now.
Yeah.
Perfect. Okay. And a little bit one here. Okay. Nice and relaxed. Good. Okay. How are you doing?
Good.
Good.
I need to stop believing everything I see on TV.
Oh, yeah. Don't believe what you see on TV. All right. So go ahead and sit up, and I want you to kind of move around. Tell me what you're feeling.
Oh, my shoulders feel a lot less tense.
A lot tense. So now your husband doesn't have to massage your shoulder anymore?
Oh, don't say that.
And how's your hips doing?
It feels good.
Okay, want to take a few steps around?
Yeah, it feels good. This is so weird.
So, feeling good is weird, huh?
Yeah, well, I mean, it's weird to like not feel like every time I do this, like I feel like a nerve, like, you know, something's hurting my back.
Okay. Well, there you go. That was your first adjustment. It sounds like you worked out very well.
I did.
Okay, very happy. Great. Okay.
22 weeks pregnant, and it was great.
It felt a lot better,
Yeah.
right? So, especially in those hips, oftentimes when you're pregnant, as you know, this is your fourth pregnancy, your hips can cause pain because the joints get really lax.
Yeah.
And then those joints are easier to go out of position. So when we found your left one and adjusted that, it should help put that back in place.
Yeah, it feels good.
And now throughout your pregnancy, it'd be a really good idea to kind of continue to check on this and make sure that...
Right next to it.
Perfect. Okay, well, I'm glad.
Cool.